Hi, I'm Dr. Khurrum Shaukat Yusafzai. Today's video is about a diving hyperbaric chamber that is installed in the Asian country of Vietnam. So Vietnam installed this hyperbaric chamber and my team at Hypertech was instrumental in installing this beautiful diving hyperbaric chamber. This chamber is actually supposed to be for the deep sea divers. It mimics the diving situation. Like, for example, if you're diving at 10 meters, you will have 1 bar of pressure. If you're diving at 20 meters, you will have 20 bar of pressure, 2 bar of pressure. If you're diving at 30 meters, you have 3 bar of pressure. So this hyperbaric chamber is designed in such a way that it will mimic the exact situation where you are under the sea. Like, for example, if you are at 40 meters, then you will have 4 bars of pressure. So this hyperbaric chamber, when the diver comes up, he has bubbles in his bloodstream. So this hyperbaric chamber is used for the diver to finish those bubbles, and we mimic the situation where you are exactly when the bubble is formed. So that exact pressure is simulated in this diving hyperbaric chamber, and then slowly we make the diver come up to surface at a very gradual rate. These rates are determined by scientific methods, and these scientific methods have resulted in diving tables. So in the diving treatment, in the diving hyperbaric chamber, we use the diving tables. We don't use the diving tables in the medical hyperbaric chamber, and it's a big mistake. Like, some of the people are using diving tables for the medical chambers. They are entirely wrong, and you should consult a real hyperbaric doctor like me when you're taking a treatment and ask for prescription with all the knowledge and the details inside. So in a diving hyperbaric chamber, the diving tables are put in practice, and after they are put in practice, they depend on the situation, and it depends on the diving hyperbaric doctor. He assesses the condition of the divers, and according to the condition, the diving tables are applied. So there are many diving tables, and the diving tables are different in the different parts of the world. For example, in America, we use the American book of reference. We call the BR for the US Navy. And in the country of United Kingdom, we use the United Kingdom book of reference, or the BR. In France, we have a French book of reference, and there are some other book of reference as well. But most widely used is the American book of reference. And these are usually applied to the diver depending on situation, and the situation is analyzed by the doctor, the hyperbaric doctor, who looks for the sign and symptoms. He takes a history, and then he makes a clinical assessment based on the many factors, and when he makes the assessment, he can apply the diving table, and according to diving table, the diving treatment is started inside the diving hyperbaric chamber. So these instructions are passed to the nurses who are diving attendants, or the nurses who are highly trained. They are also divers. They have experienced the dive themselves, and they will apply the diving tables. And when they apply the diving tables, the patient is guaranteed to recover, and there will be no bubble formation. If the patient is not treated, it's a fatal condition, and the patient can die. The diver can die, and it has happened globally many times. So the diving hyperbaric chamber has a function for emergency treatment. It is not used in the medical treatment. Most of the people are confused when they go on the internet, and they actually look at the diving tables and the diving hyperbaric chamber. They think it's same as the medical hyperbaric chamber. The medical hyperbaric chamber is an entirely different machine, although it looks the same from outside. From outside, it's the same, but the machinery is different, the pressures are different. The medical hyperbaric chamber is comfortable, and the patients are put inside for specific diseases, which are around 300 in number, and we have, for guidance, the textbook of hyperbaric medicine. We use that for the medical treatment in the medical hyperbaric chamber, and I will talk about that in my other videos. You must see my channel, subscribe to it, like it, and you can watch these informative videos over there. So the diving hyperbaric chamber is totally different, and as you can see, it is not very comfortable like the medical hyperbaric chamber. It has rounded doors just like the submarine, just like the portholes, and it's entirely different machines inside. It's not as comfortable as the medical hyperbaric chamber. Then there is a third category of hyperbaric chamber known as the wellness hyperbaric chamber, which are also entirely different machine. If you want to know about them and if you want to do consultation, you can contact me. I can help you in choosing the right hyperbaric chamber for you, and I can also provide you through my connections to the hyperbaric manufacturer a beautiful and the best machine which is suited to your needs. And I would do that after I consult you. So I hope you liked my video about this diving hyperbaric chamber, and I hope you like this video by pressing the like button, and if there are any comments, you leave the comments. I would be gladly able to answer you. And you also subscribe to my channel because this is world's best hyperbaric chamber, and there are so many informative videos for which I take a lot of pain, research, and I give you the knowledge which is not available everywhere, not even on the internet. So I hope you subscribe to my channel, and I hope to see you soon. Take care. Goodbye.